Good morning. My name is Dr. Virgil Mungalo. I'm the chairman for Live Implant Training Institute. This is a private facility in Mexico where all doctors that attend our course in 1 week will place 25 to 30 implants on patients. All the surgeries are supervised by oral surgeons, periodontists, prosthodontists, and accredited oral implantologists. We have a lot of fun during these courses, and it's a serious endeavor. One of the things that I want to invite you to look out on the social media, Facebook, and other venues is going to be the treatment planning sessions that we're going to be hosting every day. We're going to be posting 1 or 2 cases, treatment planning from how to select the case, whether it's a beginner case, intermediate, advanced, what to look for, what are the complexities, what are the danger zones, the anatomical structures, and how to plan these cases. For example, if we can zoom in here, I'm gonna go ahead and show you this. We have a typical panorex. I'm gonna go ahead and zoom here. This is a beautiful case for an intracrestal sinus lift. So one of the first things that we like to do is we're gonna go ahead and outline the maxillary sinus. There we go, right there. Here's our residual bone. So this is a common problem that most general dentists have. They see this, there's not enough sufficient amount of bone, and we have to refer these cases to a periodontist or an oral surgeon, which is fine. We want to work in teams. But properly trained, the general dentist should be able to place implants and perform this. Now, we're not talking about lateral windows. We're talking about, let me find something over here. Pull it up here. We're talking about doing intracrestal sinus lift. What are the requirements for an intracrestal sinus lift? You need to have right over here 3 to 6 millimeters of bone. So we're talking that we're going to be measuring from here to here, and we're going to be looking at having 1 implant, second implant right in here, and our third implant right in here. Now, as you can see, if we can zoom in there, we're actually just going to add a little bit of bone around these areas. So what are we talking about? We're talking about doing this much. We're talking about creating a little dome here and here. Now, we don't require a lateral sinus lift. We require an intracrestal sinus lift. All general dentists that are properly trained to do this procedure should be able to do this for their patients. This is a beautiful, safe, predictable, and very nice technique, and it's going to be taught at live implant training courses. We have our courses coming up, and we have one in November that is already sold out. We have a course in January 20 to 26, so that's going to be in the third week of January. And we have a course in March 24th through the 30th. Any of you who are interested, do me a favor, call 786-249-4510, or just send us an email at liveimplants.com. If you enroll now, you have 3 to 4 months as an early bird. You're going to be getting $1,500 discount from the typical tuition. The regular tuition is $16,000. With the early bird, it's going to become $14,500. We hope to see you there and be able to do this kind of beautiful cases. Thank you.